I think one of the biggest challenges with inclusion in clinical trials really starts from access, outreach, screening. So how are we getting patients in for screening? How are we then getting them into a clinical setting where they can be presented with a clinical trial, making sure that we have really a comprehensive process for providing all patients who are eligible for trials with information and education so they can make that decision along with their care team, along with their family or whoever else is part of that decision making. And so I think we see a variety of sort of breaks in the system, but it absolutely starts from outreach and screening and then how we're presenting clinical trials. I think we have not only an enormous amount of work to do within our own kind of cancer care teams or cancer centers, but it really does kind of expands to spheres outside of our cancer center. So it really requires a comprehensive approach. It requires us working with our community partners, religious or different value-based organizations, and thinking about how patients access their information, how they get trusted information, and how we can make sure that we're including a wide variety of patients, not only in our clinical trials, but if we don't purposefully go forward with a kind of comprehensive approach, we don't know if the therapies that we're giving patients or the genetic mutations that we're seeing are applicable across the board. And we actually know they're not. So if we don't have that level of information and we aren't really evaluating all types of patients who walk in our door, we're making a lot of assumptions that are not kind of evidence-based. So I think it goes across the board, across the continuum, and really pulls all of us together in trying to solve a solvable problem.